Okay, hi guys. This is my first ever video for something like this. Where do I begin? My name is Tracy, and I'm 46, and I am starting out on a lovely little journey that has been long coming. I will be having a vertical sleeve gastrectomy on November 30th with Dr. Ponce at Methodist Hospital in Sugar Land, Texas. Like I said, I guess I should give you some demographics first. Like I said, I'm 46. My highest weight was about 295 pounds. My current weight, I weighed myself this morning, was 276.5, I believe, on the point. And I'm 5'1". I have struggled with my weight my entire life. When I was a teenager, I wasn't, on the low end of the healthy weight range. I was at the high end. The other thing that I noticed, I know there's a lot of YouTubers out there who make these videos about having, the vertical sleeve. But I have not found anyone yet who has another medical condition. I have rheumatoid arthritis. I was diagnosed in 2009. That week in 2009 was the one of the worst weeks, of my life. I was laid off on Monday, April 20th. I was diagnosed with RA on April 22nd, which was a Thursday, I believe. And then on April 23rd, my grandmother unexpectedly passed away. So yeah, lovely week there. And you have to excuse me, I need to turn my heat down in my car. It's a little bit warm in here. So after fighting with my weight, for the better, pretty much my entire adult life, with the RA and everything, everything that I tried just absolutely failed. I have not been able to lose any significant weight with the RA, with the medications that I take, and I take a lot of them. My RA is listed as moderate to severe. I take Xeljanz for biologic, and then I take pretty much all of the other RA medications with the exception of methotrexate. I don't take that. I started getting sick on that, so I stopped taking that. But I have been on probably every infusion there is. I have taken Humira, Rancia, Simponi, you name it, I've taken it. I have not felt, RA speaking, this good since before I was diagnosed. So in my research, I have seen that people who have RA and have VSG surgery have a great impact. I mean, from what I'm reading, I think it says 76% of patients with RA who had the surgery had a significant decrease in disease activity. So that, for me, that would be a godsend for anybody that has RA. It is, for those of you who don't know what RA is, it's an autoimmune disease. It affects my immune system, attacks the small joints. They attack the synovial fluid that's between the joints. It actually, the synovial fluid cushions your joints so that they move smoothly and everything. Well, the immune system in people with RA, it attacks that. It can also, left untreated, it can also attack other soft tissues. It can attack your organs. It can attack anything, basically. So it's not, your grandma's arthritis, from years of working hard and repetitive motions. It's not that type of arthritis. This is an autoimmune disease, and there is no cure. So people who, I'm sorry, you'll have to excuse the lighting. It's horrendous. I'm actually driving. So for people with RA, one of the bad things that you really get to a lot of us is that people tell us, oh, well, you don't look sick. We may not look sick, but that's not how we feel. We live with constant pain. Even with as well managed as my disease is at this point, I still have significant amount of pain. It is manageable. I mean, I'm not like keeled over or anything like that in pain, but I guess I could equate it to being very achy, and it's something that's constant. So there's no going. It's not going to go away. Anyway, so like I said, I'll be having surgery on November 30th. This is day 1 of my full liquid diet. Yippee. This is going to be hard. I have a husband who loves food. Now, mind you, he has the metabolism of a hummingbird. He can't gain weight. It's ridiculous. I hate him. So he eats pasta. He eats, all of these different meats. He eats chips, ice cream, yada, 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 yada. Good Lord. Me, I get to drink shakes and have soups. Fun. But I have to keep my mindset that in the end, this is going to be worth it. This is going to significantly change my life. We have custody of our 10-year-old granddaughter. We've had her since she was 2, so we have basically morphed from being grandparents to parents in her eyes. So I have that other factor. There's a lot of different things going on in my life with my family that I have to do this. There's no option. My husband has cancer. His life expectancy is, I don't know. I don't know if it will. I don't know what's going on. He is significantly older than me. He's in his late 60s. But he stopped treatment for the cancers. He was diagnosed with prostate cancer in 2004. It metastasized, so it is now in his lymphatic system. And he is no longer treating it. So what happens, we don't know. We don't know how active the cancer is. We don't know if it's moving. And on top of that, he also has bladder cancer, which was diagnosed in 2015, if I remember correctly. And he did one round of treatment for that. It was a full treatment, and he said if it doesn't do anything, then oh well. So yeah, I've got a 10-year-old and a husband whose life expectancy to him is maybe a year or 2. So I I need to get healthy. I need to lose this weight. I need to get my RA under control, and I need to be able to be there for my granddaughter. Because if I die, she has no one. Literally no one. So yeah, I need to do this not just for me, but also for her, to ensure that she's taken care of. So I do have a lot of reasons to do this, but I do want to document this because, like I said, I have RA, and I have not seen any YouTubers who have or is going through VSG surgery that has RA. So for those of you who are thinking about it, are wanting to know more about how it affects people like us, then, you know, stay tuned because I will be making more of these. So if you like, go ahead, click subscribe. Sorry, I'm not going to edit anything. That's one thing that I don't really want to do. I don't want to do any editing. So you will hear all of my verbal mistakes. So click subscribe, you know, like, click the bell, get notifications for when I upload new videos. And here's to this journey. So you guys take care, be healthy, be good, and don't forget to subscribe. Bye-bye.